Well, hello, and thanks for joining us today. My name is Jackie May. I'm the COTA New South Wales Communications Lead. I can see some people maybe having some issues with sound. Uh, yeah, what I was going to say, if you do have any issues with anything, please do pop it in the chat. But as I've just said, we have got weather going on all over the place, and even the good old NBN internet can sometimes have a problem. So, I'm with the COTA New South Wales team. I live on the lands of the Wongal people and I'm on the lands of the Gadigal today. I pay my respects to elders past and present and to First Nations people who are with us today. Next week is National Reconciliation Week and the theme is Bridging Now to Next, and I look forward to taking part in that conversation. So a reminder that Council on the Ageing New South Wales is an independent not-for-profit organisation. We represent the people aged 50 years and older in New South Wales. We work with and advocate for older people to ensure their views are heard and acted on. So welcome again here today. If you're new to our webinars, we introduce the topic and speakers and then talk to us in detail. The webinar is being recorded and will be available to view on our website in coming days, particularly if you're having trouble with anything this morning. You can catch up with all our past webinars there as well. So do send your comments and questions by using the Ask Question function at the bottom of the screen. All comments is fine. Don't be shy. If we can't get to you, email our webinar is info@cotanewsouthwales.com.au. I see it's raining in Port Macquarie. It's pretty windy. They've had half a metre of rain, but Margaret is warm and dry. That's good to know. It's rain in the Central West. I know that will be welcome for some people. And I hope all of you can hear us coming through loud and clear. So today we're talking about Wellness to Age, the Wellness to Age program trial. It's an innovative, evidence-based approach designed to support older people to stay active, independent, and engaged in their communities. This is something that's important to all of us. So it's been developed by a team of allied health experts. The program focuses on improving mobility, cognitive skills, and social wellbeing. So joining us are some of the dedicated allied health professionals behind the program from the Three Rivers Department of Rural Health at Charles Sturt University in Albury. And they'll be joined by Greta, our lived experience expert, who's going to talk about the impact of participating in the trial. Hi, Greta, lovely to see you. And we're also being joined by aged care support worker Suzy, who will also share her experience of being involved with the trial. Great that you can join us also, Suzy. So remember, we want to hear from you with your comments or questions as we go. So I'm going to hand over now to Dr. Kristy Robson, who is going to introduce the webinar and run us through the speakers. Over to you, Kristy.
Thanks so much, Jackie, and we're so delighted to be here today to talk to you about our program. So I'm just going to share my screen. So we've got a bit of a program a PowerPoint to show you. Yeah, I might just need to. I might just stop sharing just for a second and then put it on presentation mode, if it will do that.
Kristy, let us know if you would like Soren to start your presentation.
Yeah, I think that might be really good because I think, yeah, there's something going on with my computer. Technology is always an issue.
So attempt to get the presentation up, but Kristy, if you want to just tell us a bit about yourself while we're waiting.
Yeah, so So just before I begin, I'd like to also like to acknowledge the land that I and the rest of our presenting team come from, which is Wiradjuri country. I'd like to pay my respects to the traditional owners and custodians of this land, and I recognise their continuing connection to land, water, culture and community, as well as paying my respects to elders past and present and any Aboriginal and Torres Strait Islander peoples with us today. So, it's my mouse. Okay, so the presentation is up. Great. So can we just move to the next slide, Siren? That would be fantastic. Okay, so as Jackie indicated, my name is Kristy Robson, and I'm a Senior Research Fellow at Three Rivers Department of Rural Health at Charles Sturt University, down on the border of New South Wales and Victoria. We're based in Albury. I'm also an allied health professional, so my professional background is working as a podiatrist, and I'm one of the co-founders of the Wellness to Age program. I'd also like to introduce Associate Professor Melissa Nott, who is the Principal Research Fellow at Three Rivers Department of Rural Health, and she's also the other co-founder of Wellness to Age, and she has extensive experience as an allied health professional in occupational therapy. And finally, from the research side, I'd like to also introduce Dr. Liana Green, who has been the amazing research fellow on this project. And she's a social worker by background and has been a really great asset to our team. So we're very, very fortunate to have her. So next slide, please. Okay, so firstly, I just wanted to highlight why we wanted to develop the Wellness to Age program. So as allied health professionals, we were really seeing a number of challenges that existed in the current community-based programs that are available. And this was particularly evident in rural areas. So some of those challenges include that programs are often focused on a reactive approach of waiting till someone has actually had a diagnosis or had an injury, and then we wrap around supports for them. And also a number of these programs tend to really just focus on one specific diagnosis or an injury, that rather than looking at the individual from a holistic perspective. So a lot of the existing programs are things like falls prevention or memory classes or exercise programs, but and don't really look at multiple aspects of aging. Another real issue is often these community-based programs, in these programs, pretty much everybody does the same thing. And while there might be some variation to accommodate limitations people will have, pretty much everybody does the same type of approach, and that might not suit everybody's individual needs. And so that can be a real problem. And additionally, programs don't always offer ongoing support or strategies to really enable long-term benefits after people finish the program. And really, again, from that rural perspective, there's a lot of limitations or limited access to community-based programs that can really help older people as well. So that was, really the fundamental reason why we wanted to look at something a little bit differently. Can we go to the next slide? Thanks. So it was really clear that we needed to design a program that could really focus on supporting older people, not actually when they've had a diagnosis or injury, but actually before this, when they were starting to notice some of the difficulties, so that we could really be much more proactive in supporting people to age well and really maintain their independence. So we took on board all of these known challenges, and we talked a lot to older people about what they would value in a community-based healthy ageing program. And from that, Wellness to Age was born. Next slide, please. So the Wellness to Age program was developed for community-based dwelling people over the age of 60 years. And all they needed to have was just to be experiencing some sort of changes in either their physical ability, their cognitive ability, or both. And it was designed to be a 10-week program, 1 hour a week, where older people could actually undertake a range of structured activities aligned to their individual goals. So the next slide, thanks. So in the first week, we undertook a range of pre-program outcome measures. So we really wanted to know what individual people's goals were and what they really wanted to focus on. And we also assessed their mobility, their cognition, and their quality of life through a range of different outcome measures. And then after week one, the following 9 weeks, individuals were paired with another person that had a similar goal to them, and they learnt a range of aging well strategies which they could apply to the activities that they were completing each week. And the chosen activities were really matched to align the individual person's goals. And each activity had a cognitive task as well as a mobility task, which was also graded. So the activity was challenging enough for each participant. So you might not necessarily be at the same grade as your partner, but you were able to get enough challenge and it wasn't too difficult for you to complete. In the last 10 minutes of the program, we then reviewed how people had gone with those chosen activities and then planned the activities for the following week. And then in week 10, we redid all of the outcome measures to see whether they'd actually changed from week one or there'd been any difference. Next slide, thanks. So the ability to translate strategies learnt within the program every day is a really key focus in the development and implementation of our Wellness to Age program. So for every activity that we undertook, there was information provided on how this specific activity would assist with individuals living at home and within the community. And participants were provided with a handbook that outlined the weekly at-home activities that they could practice to embed those individual strategies and seek clarification before the end of the program. Next slide, thanks. So what really sets the Wellness to Age program apart is its focus on the whole person. The program targets both physical, cognitive, and social well-being, and it recognises that ageing well involves more than just one aspect of health. We took a proactive strengths-based approach that builds on what older people can do, not just what they've lost. And the aim is to really help people maintain their independence for home for longer, using the strategies that are practical, sustainable, and actually embedded in everyday life. And so ultimately, the Wellness to Age program isn't just about aging, it's about living well while aging. Next slide, thanks. So this has been a long journey for Mel and I. And so the Wellness to Age program started back in 2018, where we had this bright idea to do something. And we developed the program and did a little pilot study back at our university, at Charles Sturt University in Albury. And the following year, we piloted the program across the year in different formats to see what was working, what wasn't working, and we continually refined the program along that process. And then 2020 hit, and then we all know that COVID hit, and so we had to pivot and stop running the program. So we really focused on disseminating a lot of the early findings that we had and really building interest. And so that really built some momentum, and which led to some university funding in 2021 to really digitalise all of our training and program resources, and that was going to help us get a broader reach. And so in 2022, we secured additional university funding to build an online platform. And then we were very lucky to be successful in gaining a HCF Foundation grant, which really provided the funding to run a clinical trial during 2024. And this trial really allowed us to rigorously test the feasibility and effectiveness of the program across different health services and locations. So during 2024, we implemented that program across 4 sites with 3 organisations in regional New South Wales. Next slide, thanks. And so we were able to undertake this clinical trial through the financial support of HCF, and we partnered with those 3 different service providers. So Live Better was a community-based aged care provider where aged care support staff, such as Suzy, facilitated the program in both Wagga and Orange, and they were supported remotely by Liana as the allied health professional. And older people who were using existing services of Live Better through home care packages were recruited to undertake this, this program in that location. Icaria Health was one of our other partners, and they were a community-based private allied health organisation where an allied health professional facilitated the program with existing clients that were on NDIS or home care packages. And our last partner was Albury Wodonga Health, and they were a public outpatient service who recruited from their existing outpatient services as well as their cognitive dementia and memory service. And allied health professionals led the delivery of this program with the assistance of an allied health assistant. And so with those individuals, we also looked to see whether the program was beneficial for those that had mild to moderate cognitive impairment as well. And so now I'm going to hand over to Melissa to actually go through some of the outcomes that we found during the trial. Next slide, thanks.
Thanks so much, Kristy. So it's my pleasure to share with you the outcomes of our community translation trial. And whilst we are here today sharing the outcomes with you, they are not our outcomes. They are the outcomes of each person who participated in the trial. And so each slide has a photo of one or more of the people who've participated in Wellness to Age. And as I share these outcomes, I'd like you to look at each person and witness the joy and the courage that it takes for each older person to volunteer to participate in research trials, to take positive action to improve their lives, and to thrive in their older years. So if you could go on to the next slide, please. So 40 people met the inclusion criteria and enrolled in our trial at one of the 4 trial sites, and 29 people completed the program. Of the people who did not complete the program, 2 chose to engage in an individual allied health program rather than a group-based program. We had 4 people who had exacerbations of existing medical conditions and a further 6 people who had surgery or acute injuries during that time and withdrew. The average age of participants was 75 years and 3/4 were female. All were mobile with or without a mobility aid. And participants with moderate, mild or no cognitive impairment were included in the trial, while participants with severe cognitive impairment were not eligible to participate. Next screen, please. So as Kristy said, one of the points of difference between Wellness to Age and other group programs is that we individualise and tailor the selected weekly activities to align with participants' goals. So the program facilitators were trained to administer the Canadian Occupational Performance Measure, or the COPM, and this is completed with each participant either prior to the program or in week 1 of the program to set goals. So a range of goals were identified by our program participants, including specific tasks such as gardening, volunteering, and meal preparation, and also specific abilities that participants wanted to enhance, so things like their strength, their balance, and their memory. So now I'll share some of the outcomes of the trial. Next screen. So before I do that, I just wanted to share a participant quote with you. So one participant said, "It was good. Yeah, I had quite an improvement in my balance. I think a lot of the balance stuff that I've been working on for a while, because I've had a lot of falls, I never thought that I was getting better. And then they timed me and I said, oh, I got significantly better." So taking pre and post outcome measures was really valued by older participants who could see the changes that they had made. Next slide, please. So our primary outcome measure was goal performance and satisfaction measured by the COPM. So briefly, the COPM is a person-centred, occupation-focused outcome measure which uses a semi-structured interview format and a structured scoring method. The COPM measures self-perceived changes in occupational performance and satisfaction at 2 time points, so in this trial, before and after the program. Changes between these 2 times indicate benefits from the program, and performance and satisfaction are scored out of 10. Self-rated performance of goals increased from 5.1 to 5.9, as you can see on the left-hand side, with satisfaction increasing significantly from 4.7 to 5.9 out of 10. These benefits were observed and equivalent across all of our trial sites with all partner organisations. Next screen, please. So in terms of cognitive outcomes, we measured these using the participant-reported evaluation of cognitive state, which is called the PRECIS. This is a 27-item measure asking people about the impact of cognitive problems on their day-to-day life. So therefore, a higher score indicates more self-reported cognitive problems. And again, we measured this at 2 time points before and after the intervention. A significant reduction in perceived daily cognitive errors was evident, and the greatest reduction in cognitive errors was reported by participants at Live Better and also at Albury-Wodonga Health. Next screen. Mobility outcomes were measured using the 4-square step test. So this test was chosen because it can be conducted in a small area, so unlike, for example, the 6-minute walk test, and is more dynamic than things like the sit-to-stand test. The 4-square step test measures rapid stepping, changing in direction and avoiding obstacles, therefore simulating the skills required for walking. The 4-square step test is measured in time, in seconds, taken to complete the sequence, and is performed twice. So the time required to complete this test reduced significantly from 11.4 seconds to 9.5 seconds, indicating an improvement in dynamic mobility. Improvements were observed in participants across all of our trial sites on the FSST. Next screen. Finally, changes in self-rated quality of life were measured using the quality of life for aged care consumers, which is called the QALAC. This is an instrument for measuring and valuing the quality of life of individual older people who rate their perception of their own quality of life across 6 areas: independence, mobility, pain management, emotional well-being, social relationships, and leisure activities, using a 5-point scale for each of those 6 areas. A statistically significant increase in quality of life was reported by participants with a large intervention effect, and a similar level of improvement was reported across all of our trial sites. These findings, in summary, indicate that significant improvements in goal performance and satisfaction, mobility, cognition, and quality of life were achieved by participants following the 10-week Wellness to Age program. Improvements in goals, mobility, and quality of life were consistent across all participating organisations, with some differences in cognitive outcomes evident between organisations with different client profiles. This next screen shares some more feedback from participants. The feeling was just, yeah, I didn't want the program to end because of that feeling that I had. I was so happy to walk out of there and happy when I got home. No one liked to get old. My age has just crept up on me. Okay, next screen. So now I'll talk about some of the feasibility and acceptability outcomes. So as this was a real-world implementation trial, we sought to not only evaluate the efficacy of the program from the perspective of participants, but we also sought to understand if Wellness to Age is feasible to implement in the 3 health and aged care partner organisations, and if it was acceptable to staff, facilitators and participants. So in terms of feasibility, all staff who completed pre-screening reported the screening process to be feasible. This included administration of the mini mental status examination, either in person or via telephone, or for participants who were clients of Albury Health's Cognitive Dementia and Memory Clinic, this included the screening, the Addenbrooke's cognitive evaluation. All staff who completed the pre and post outcome measures reported these to be completely or partially feasible. These were completed by allied health professionals on site, if available, or remotely by a trained allied health professional. Staff noted that the time required to complete the pre and post outcome measures was usually 40 to 60 minutes for the pre measures and approximately 20 to 30 minutes for the post measures. 100% of staff who facilitated Wellness to Age identified program delivery, staffing requirements, time, space and equipment requirements, and provided resources to be completely or partially feasible. Wellness to Age was seen as both structured and adaptable, which staff identified as a key strength. Oh, if we can just go back to the previous screen. And because it supported the delivery across different service settings. Staff highlighted how the design included a consistent session format with the mixture of cognitive and physical tasks, and built-in progression of difficulty was effective and easy to follow. Facilitators acknowledged that logistical and staffing issues could affect feasibility of the program, and this included identifying available space, negotiating scheduling constraints, and staffing ratios that are required for safe and effective facilitation. Staff also noted that they felt more confident delivering the program when paired with another facilitator. And for aged care staff who had had limited prior experience of this type of program delivery, working alongside a colleague helped them to manage sessions more effectively and built their confidence in a model that was originally designed for allied health professionals. Next page, thanks. So facilitators also noted that the program design supported adaptability for diverse participant needs. And this was particularly valued in aged care settings where participants presented with varying levels of function. The ability to tailor content without compromising the core program elements contributed to its feasibility across different settings. Next slide, please. In terms of acceptability, participants were invited to complete a program acceptability survey at the completion of the Wellness to Age program, and 25 older people completed the survey and gave feedback on the acceptability of the different program elements that are listed on the screen. Each element was rated as completely acceptable by 75 to 95% of participants, or acceptable to some degree by 5 to 25% of respondents. There were no program elements reported as not acceptable by any of our participants. The majority of participants provided positive feedback, stating that the program was a pleasure to attend and that the facilitators were amazing, and that each week participants looked forward to going to the program. Elements of the program that received the strongest endorsement from participants were that the program was enjoyable, the value of the program being individualised to the person's needs, and the facilitators. Participants described the program as well organised and thoughtfully paced, but what made it truly acceptable was its emphasis on flexibility and inclusiveness, which created a positive and low-pressure environment. The structure was experienced as purposeful and relaxed, allowing participants to engage at their own level. And program activities were not only engaging, but were perceived to have a clear intention behind them, which contributed to participants' confidence and their perceived progress. Additionally, the format helped participants understand the rationale behind each session, which in turn legitimised their effort and time in attending. The sense of being part of something meaningful rather than arbitrary reinforced program credibility. So I'm now going to hand over to Liana, who is going to speak with Greta and with Suzy about their experiences facilitating and participating in the program. So we might stop screen sharing so that everyone can see Liana and Greta, and I'll hand over to you now.
Oh, thanks very much, Mel. I have the great delight of being here with Greta today, and next I'll talk to Suzy. It's been a delight to be part of the Wellness to Age program, and I guess some of the biggest delights of being a part have been being the allied health professional, working with Suzy and her team at Live Better, and also being a part of the interview team, interviewing the participants like Greta. So I would like to welcome you here today, Greta. It was lovely to meet you in the interview and to see you again today. So I'd like to introduce Greta Rolton, and we're just going to have a chat and talk about some aspects of Greta's perception of the program. So, Greta, firstly, I'd just like to ask you about what were your overall impressions of participating in the Wellness to Age program?
Well, I think it's been all summed up, but I found it enjoyable. I found it very informative, motivating. Yeah, honestly, I've lost for words, but yeah, overall, I think I learned a lot from it. I enjoyed it. Yeah, it was an eye-opener for me.
Yeah. You know, when you talk about being an eye-opener, were there anything that you were surprised about within the program and your participation?
Yeah, look, I went there particularly just for the main reason to support my husband. And I thought, I'm terrific, I'm fine, I'm great, you know. And like that gentleman said earlier, the comment was age has crept up on me. Well, that's what this did for me. I realized that, wow, I'm not as sharp as I used to be, like in responding to on-the-spot questions or like some of the activities where I sort of I stumbled. And also the other thing I found was my balance. I didn't realize that I was so wonky. So that really did surprise me about myself. Yes.
Yeah.
Yes.
Oh, thanks for that, Greta. I'm wondering what you did with that new information that you had about your cognition and your mobility.
I've done a lot actually,
Yeah.
and it's together with Peter. We've actually joined an exercise group through My Aged Care. We've actually connected with My Aged Care. We've also become more sociable. That was something that we didn't do before, which it motivates. It's the motivation. So joining a group like an exercise group, you're not only benefiting from feeling better in your body, but you're also feeling better because you're being socially connected.
Yeah.
And it's great for me seeing improvement with Peter.
Yeah.
And also for me. So
yeah,
that's.
Yeah. Oh, thanks. I wonder if you can speak a bit about that improvement that you noticed during your time in the program, Greta.
Okay, well, one is happiness.
Yeah.
That's really improved. Two, our physical, my balancing.
Yeah.
I haven't really lost any weight, which I'd like to do, but you know, I am better at balancing. I feel more confident. And then with Peter, I think, can I speak about him
Yeah,
too?
please
Yeah.
do.
Yeah, well, so with Peter, I've noticed with the strategies that we were given, and this is the cognitive strategies, instead of me as a carer getting all cranky and crabby at his inabilities to, or his decline into doing things, with those strategies now, it's more like a game and it's fun. And the one thing that, you know, for Peter and for me, it's like, first, there's one strategy that stands out most is stop, think, and do. So when Peter gets all confused or anything and he gets upset, and I'll say, okay, just stop for a minute, think about it, and then we'll do it. And so things like that, and also, okay, we're not feeling great today. Let's go for a walk. This is good. This is going to. So yes,
Yeah.
that,
So it sounds like some of the strategies you've actually really incorporated in your everyday life at home that you've taken from the program.
absolutely.
Yeah.
It's and the thing is, the strategies are easy to remember. I think that's another thing, and they're easy to do. It's not like you've got to go onto YouTube or a TV channel and force yourself to do exercises. These actually they're just so easy, and just I don't know how to put it. It's just fun and easy and beneficial.
Yeah.
I think, yeah.
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 Well, you know what where I'm transported to, Greta, is I remember in the survey that you wrote that quote that the program helped you to delay the decay. And I'm wondering if you can speak a bit about what you meant by delay the decay and what that meant for you.
Well, okay. Well, like I said in the beginning, the program was a surprise to me.
Yeah.
It was for me. And for me, getting older is losing muscle,
Yeah.
getting ugly, and not having balance, not thinking as clearly, all those things, and losing motivation.
Yeah.
And feeling isolated. And so that's the decay part of it.
Yeah.
And by doing this course, it's motivated me personally to want to get better. It's and to I can delay decay. I can improve my balance. I can think quicker.
Yeah.
I can cope more with other things that are going on with my life emotionally. So that's the decay. So that's a delay. That's remaining more positive, more healthy, more in touch, more in tune. So that's delay the decay. Like eventually, I know we all end up as dust, but to get to the dust, I'd like it to be a healthy, happy way rather than just sit in a little hole somewhere.
Yeah. Yeah. Thanks for that. What I'm really taken by is that sense of being in tune with yourself and your own experience. Can you speak to me a little bit more about what you felt about that you were more tuning into your own experience from the program?
Tuning in. Well, how do you mean? Like,
It felt like that what I'm hearing you say is you got to know yourself in the program. You got to know a bit about your capacities a bit more.
absolutely, yeah. I realized that I was in a hole, basically, and I really sort of had given up on just accept the fact that, oh, you're getting old and you're this and you're that. But this program, it made me realize that I can do something about, I can help myself. I can improve on what I feel is wrong with me, like being depressed. I can connect. I can join groups and being in a regional, being new to a regional area too. I found that connecting with people and groups was hard, whereas this Wellness to Age gave me the opportunity to find connection, to connection with groups, connection with realizing things about myself, how to become a happier person. Just acceptance. And also it helped me tolerate and understand Peter more in his journey. So yeah, It was great. It
Yeah.
was really a good course to be in. Yeah, I enjoyed every bit of it.
Oh, thanks for sharing that, Greta. And I'm wondering, what would you say to someone considering participating in the Wellness to Age program?
I wouldn't even bother considering. I'd just go and jump in and do it. I think, like it's been pointed out, and like I felt and experienced, it's a safe place to be. It is the journey, your own personal journey. It's at your own pace, even though you are with, like I went there as a very judgmental person, thinking, oh, there's nothing wrong with me. Why am I going? And in the end, I thought, wow, there's a lot wrong with me, and joining up with these other people, and they were all journeying the same journey as I was journeying, but we were all doing it together, but in our own way, and enjoying it together. So yeah, I'd say definitely do the program. It brings about awarenesses that you might not have had about yourself.
Wonderful.
Yeah.
Well, thank you so much, Greta. I really appreciate your time today, and thank you for coming in, and thanks for participating in the program. It's been a delight to have you and Peter a part of the program, and thank you so much for coming in to speak to us today.
I'd like to go to another program.
Yeah.
I really
We'll
would.
put your name on the list.
Thank you.
Thanks so much, Greta. Thank you.
Thank you.
And Suzy, I'm wondering if I can see your lovely face online. I'm wondering if you're happy to join us now. I might just turn this around a bit. I had the great pleasure of working with Suzy quite closely for all of last year. Suzy's one of the 5 Live Better facilitators who were trained across Wagga and Orange. And I was the very lucky allied health professional who worked with Suzy and the team to support her and the team to choose some of the activities and also to work with each week. So it's lovely to see you again, Suzy.
Thank you, Liana.
Suzy, I'm just wondering if you can talk to me from a facilitator's perspective, if you can share a bit about what your experience was of facilitating the Wellness to Age program.
Yeah, no, it was really myself and I had 2 other facilitators in Wagga, and we all really enjoyed it. I guess it was nice to be part of a group that treated the clients as individuals, and see the improvements over time, which was really great. Because when they first started, some of them were, I wouldn't say negative, but not as positive. And then when they got in, and it was quite fun as well, the activities. And as we got towards the end, you could really see the improvement. So we were very lucky, and the clients really enjoyed coming along, which was nice. Yeah, so no, it was really, really enjoyable.
Yeah, oh, thanks, Suzy. And I'm wondering if you can comment on some of the benefits that you noticed that participants had from participating in the program.
Yeah, so just in balance was a really big one. So I would say all of them increased their balance, which made them feel a lot more confident. And cognitive wise as well, memory wise, I think most of them, because of the strategies, it really did help them, and they did mention that as well, that the strategies helped them. They were using them at home. Yeah, so that was all really positive.
Yeah. And also, Suzy, when I'm hearing you speak, I'm just mindful that I was there for the final session of one of the groups, and there was a lot of laughter going on in that group. And I wonder if you can share a bit about that experience of what was happening to cause that laughter, and how that what you saw in the participants and how that felt for you as a facilitator being a part of that.
Yeah, so it was a lot of the activities, as you know, were sort of based a little bit around the fun element. So they have the underlying fun element, I guess, but you also get the benefit out of it. So all the sessions were really quite enjoyable, and it was good to see the customers who attended or participants, they also encouraged each other. Yeah, so it was rewarding and it was very fun. Not only for the clients, but also for the facilitators as well. So we enjoyed it. We all had a good time. Yeah.
Can you speak a bit more, Suzy, about your experience, if there's anything that you got out of the program or your fellow facilitators? Were there any benefits for you as being a facilitator?
I think myself and the other facilitators all sort of mentioned we all got something out of it. Confidence-wise as well, being able to run the group, because at first it was a little bit daunting, just like anything new, but it was the information we received was really helpful. And of course, Liana, we were lucky enough to have you to reach out to if we needed anything, which was lovely. But once we got in there, it was quite an easy group to run, which was great. Yeah, so we really got, I guess, the confidence of running a group was really beneficial, and also the strategies. We started to use the strategies as well, so we found that really helpful. Chunking information and just things like that. Yeah.
Thanks, Suzy. Can you share a bit more about what you recall from the strategies that you shared with the participants?
Yeah, well, like Greta said, what was it? Stop, think and do sort of one. That was something that we did in every session. And it was really beneficial for everyone, and not just for the memory, but also when we were going into something physical, because a lot of them automatically, as you do yourself, go into autopilot and you just go for it. And we had a few people who had falls in the past. So that strategy, when they started to do that, just, take it easy, stop, think about it, and then stand, get their footing, and then do the activity. It all ran so smooth and they felt more relaxed, I guess, and happy to go ahead, because we did have, there was one lady who had quite a few falls, and she at first was a little scared to do some of the activities, the physical ones more so. But as time went on, she just gained that confidence and strength as well, because she was doing little bits and pieces at home. And then she was going great guns. So, yeah, it was good.
Oh, fabulous. And you mentioned home, Suzy. I know that you have an ongoing relationship with the people who are participants who are still customers of your service. Has anyone spoken about the program in the time that you've seen them since they've finished the program?
Yeah, absolutely. So there was one gentleman, and he actually wanted to do the second group as well. So he was very keen. I think the social aspect of it as well is really important. And that was something he really enjoyed as well. And getting up, when he was at home, he's sitting down a lot of the time. So he did mention to myself and some of the other carers who have been attending, just he's walking around more and things like that, because he's putting some of those strategies still into place, which is really good to hear. So he's built strength and confidence out of that. There was another lady who I spoke to, and well, everyone I've actually spoke to has taken something away from it, which is wonderful. This particular lady, she was still doing some of the strategies at home as well. Left and right hand side of the brain activities and so forth, and less dominant hands and things like that. So all of them that I have spoken to have taken something away from it, which is great.
Yeah. Thanks, Susan. I wonder if there's anything you've taken away from the program as a facilitator.
Definitely some of the strategies as well. So the chunking information and and just another thing. I mean, some of them they sort of got their own strategies, and when they were trying to remember information, if there was numbers in that information, they had to relay it, they would rattle off the number first because that was the hardest thing to remember, and the other was chunked behind, and then they could relay that all better. So it's quite interesting to see that type of thing where they're working out their own little ways to remember things. But myself, definitely the strategies and the individual working out the process for the person individually, I think is a really great idea because they are like anyone else. We're all different, and it caters for everyone. So it's been really good opportunity.
Well, thank you so much, Suzy. Thank you so much for speaking to us today. I didn't introduce you properly before we started, Suzy. I was so keen to hear from you. But I'd like to introduce at the end Suzy Hann, who's an aged care worker and a team leader at Live Better in Wagga, who's representing the Live Better organisation. So thank you so much for joining us today, Suzy, and sharing. And thanks, Greta, for coming and sharing your experiences. It's been an honour to know you both and to listen to you today. So thank you so much for sharing.
Thank you.
Thanks, Liana, and thanks for letting me be part of the program.
Oh, it's been an honour. Thank you so much.
Thank you.
Over to you, Kristy.
Great. Thanks, Liana. I can see that there's a few questions in the chat aspect. And there's just one on the Q&A. So there's just there's one indicating that participants, because we had a lot of photos in our presentation, and I just want to reassure everybody that all of the photos that were taken of participants, the participants were asked for permission and signed permission, and were actually paid to do a bit of a photo shoot for us so that we could have some photos to attach to our Wellness to Age program. But some of the other comments are, I can see that there's lots of positivity that's saying, this holistic approach is really, really a great idea. And there's a number of comments that sort of indicate that, where can we go and do this program? Is it freely, is it available broadly? We would love for it to be available broadly. At the moment, we've just finished our clinical trial, and really our next steps is to look how we can actually partner with a whole range of organisations in broadly across geographic areas to actually get this program out. But obviously, we're just at that stage where we've just finished the trial, and then the next 6 months we'll be really looking at opportunities to partner with organisations to really see if people are willing to be trained. And so we do have it. The process is that we do train allied health professionals and aged care support staff, and then they can actually deliver the program at their local organisation. And so we do have a website, and if you do have any particular questions about how you get trained, what sort of opportunities might be in the next 6 months or so, then you can actually send us an email through our website and we can have a conversation with you. But at the moment, unfortunately, we don't have the program running out broadly, but that's really our ultimate aim, is to really get this program up. And so that's, really important for us. And maybe if we can just put up the slide that has the website contact details. That would be great if we shared that slide. There's a question from Margaret that says, how often can one do the 10-week program? That's a really great question. I think you heard from Greta that she would love to do the program again, because the program is very much based on individual goals. Your goals change. So what your goals were 4 months ago, you might have new goals. So you can absolutely redo the program and just have different goals. And so I think that also gives you the ability to reinforce some of the strategies that you've learned. And so that's really a great option. And so we have designed it so that people can actually redo the program on a regular basis if they choose to, if their goals are changing, or they don't have to, they can just take those strategies and learn from that as well. And, I suppose one of the other key things, I'm just picking up on Suzy's point around, these are not necessarily strategies just for older people. These are strategies that anybody can use. And so, even people that are facilitating the program, clearly Suzy picked up on some of those strategies. So, as we're aging, whether it's middle age or getting a bit older, we can utilize a lot of these strategies to be much more preventative and proactive in our ability to age well. So obviously if you're looking for activities that you can potentially access, it would be really good that, if you can have a look around your local area to see if there are any sort of community-based programs, because obviously something is better than nothing, and really, social engagement is a really big, important factor in being able to age well. So whilst we're in this phase of trying to, get our program out there more broadly, there are other community-based programs that people can attend. And I would encourage people, if they're feeling like they would like to actually attend, have a look at some of the local programs that are actually available. So question.
I might just jump in to answer a couple of other questions, give you a break.
Yes,
there,
thanks, Mel.
That's fine. I can see a question from Marvin. Can we become a facilitator and will there be training? So yes, as part of this trial, we developed a training program which we delivered to a number of allied health professionals, allied health assistants and aged care workforce in March, April of last year. It has two components to the training. There's some self-paced modules that online that people need to complete before then. There's a 5-hour live training with Kristy and Liana and myself, and that training is all done online. And so we will have that training available for people who are interested in becoming trainers and then facilitating that program within their own organisations or communities. And I note that Amanda made the comment about it would be great to run things like that, maybe in a community church hall or a community space. Absolutely. While we partnered with health services and aged care service providers who had their own spaces to run the program, it does not need to be run within the environment of a health service. It could absolutely be done in a community hall or other space like that. Tracy's asked the question, she's a social worker like Liana. Can she become a facilitator of the program? Yes. So again, feel free to send an email to our email on the screen or scan the QR code, as we will be, once we've finalised this trial, we'll then be starting to look at making training opportunities more broadly available for people who are interested to becoming trained and then then implementing the program in their own organisation. I think that looks like all of the questions, although another one just popped up. Kay asked about the Sutherland Shire. At the moment, Kay, our focus has been in rural and regional areas of New South Wales, which is where we live and work. But if there are program facilitators in that area who are interested in becoming trained and delivering it. It can go to any location across the state or the country. So please do keep an eye out on our website, and we can continue to update that when we have more people trained and being able to then deliver the program.
And there's just one comment or question from Judy. How will it be costed? So obviously, when it's run by allied health professionals, there is potential funding that you can access or through your private health insurance. As you know, you're saying when you do go to your physio, you pay through your health fund. Obviously, health professionals can, in some health professionals, you can claim for group programs. In our system or in our trial, people were able to access the program via their, some of them were able to access it via their NDIS plans, others were able to access it via their home care packages. And, you know, obviously we're looking at models where we're trying to keep the costs down so that it isn't cost prohibitive to people. So, yeah, so there's a range of different funding mechanisms that may support you once this program is out in the community.